We've all heard that sleep is the best medicine, and for most of us, that's true. But here's something worth knowing. For those of us over 60, the position we sleep in every night might actually be working against our heart and our brain, quietly, while we rest. I'm Dr. Sarah Mitchell, and today I want to walk you through 5 common sleep positions that can put unnecessary strain on your circulation as you age. And more importantly, 2 simple, comfortable adjustments you can make tonight to help your body recover the way it's supposed to. This isn't about scaring you. Most of us have slept the same way for decades and feel fine. But small, smart changes to how we sleep can make a real difference, especially if you're already managing blood pressure, heart health, or you've been waking up with morning stiffness, headaches, or that foggy feeling that just won't shake. Stick with me to the end, because I'll give you 2 specific positions that can genuinely support your heart and brain while you sleep. And I'll tell you exactly how to make the switch comfortably, even if you've slept the same way your whole life. Before we get into it, if you are new here, welcome. I'm Dr. Sarah Mitchell, and every single week I share health information that actually matters for people over 60. Hit that subscribe button right now and join our community. It is completely free, and it could genuinely make a difference in your health. Okay, let's get into it. Let's start with number 5, sleeping completely flat on your back with no elevation at all. Now, I know this one surprises people. A flat back feels natural. Your spine is straight. A lot of folks have slept this way their whole lives, and in your younger years, it was probably fine. But here's what changes as we get older. When you lie completely flat, blood naturally pools toward your head. In your 20s and 30s, your blood vessels are flexible enough to handle that shift easily. But after 60, those vessels become a little stiffer, a little less adaptable. And when blood pools in your head for 7 or 8 hours straight, it can create subtle pressure buildup that your brain has to work against all night. You know that dull, pounding headache you sometimes get in the middle of the night or first thing in the morning? Or that groggy, heavy feeling when you sit up? A lot of seniors assume that's just part of getting older. And sometimes it is. But sometimes it's a sign that blood flow during sleep isn't as smooth as it could be. The good news is the adjustment is simple, and I'll show you exactly what to do at the end. But first, let's talk about number 4, because this one surprises almost everyone. Number 4, sleeping on your right side, specifically if you're managing heart issues or high blood pressure. Now, I want to explain the why here, because once you understand it, it makes a lot of sense. Your heart sits slightly left of center in your chest. Running through your body is a large vein called the inferior vena cava, which is responsible for carrying blood from your lower body back up to your heart. When you lie on your right side, your body weight can put mild pressure on that vein, which means your heart has to work a little harder to pull that blood back in. For a healthy person in their 30s, this is not a significant issue. But if you're over 60 and you're already managing borderline heart function or blood pressure, think of it this way. Your heart is already working diligently every day. Adding 7 hours of extra workload every single night is worth reconsidering. Here's something interesting. Many people with heart conditions instinctively find right-side sleeping uncomfortable. That's your body giving you a quiet signal. If you're already managing blood pressure and you're a right-side sleeper, this is worth bringing up at your next appointment. If you're a right-side sleeper, keep watching, because number 3 might apply to you as well. Number 3, sleeping with 2, 3, or even 4 pillows stacked under your head. A lot of seniors do this hoping it helps with breathing, acid reflux, or sinus drainage. And some elevation does help. We'll talk about that. But here's what too much elevation does that most people don't realize. When your head is pushed too far forward by a stack of pillows, your neck bends at an angle that puts pressure on the vertebral arteries, 2 important blood vessels that run along the sides of your neck and supply blood to your brainstem and cerebellum. These are the parts of your brain that manage balance, coordination, and awareness. If you're noticing morning stiffness in your neck, a dull ache at the base of your skull, or that groggy, foggy feeling when you first get up, your pillow stack may be contributing more than you'd think. The recommendation I give most often is simply this: One well-fitted, supportive pillow with a gentle contour that follows the natural curve of your neck. A lot of my patients are surprised by how quickly morning neck pain eases up after that one change. Number 2, sleeping in a tightly curled fetal position, knees drawn to the chest, chin tucked down. This is one of the most common sleep postures, and it does feel safe and natural. So I want to be gentle here, because for a lot of people, this is their most comfortable position. But there are two things worth understanding. First, when your body is curled tightly, your rib cage compresses, and your lungs can't fully expand the way they normally would. Every breath you take all night is a little shallower than it should be. If you've ever woken up feeling like your chest was tight or it took a moment to take a full deep breath, that can be part of why. Over a full night, shallower breathing means slightly less oxygen is circulating through your body. For someone already managing cardiovascular health or early lung concerns, that adds up in small but meaningful ways. Second, when your neck and upper back stay in a curved position for hours, the muscles around your cervical spine stay under constant tension. Small blood vessels near the base of your skull can feel the effect of that compression. The adjustment here isn't complicated. You don't have to give up side sleeping entirely. Simply straightening out a little, extending your legs more, keeping your chin more neutral, can make a real difference. A pillow between your knees also helps your hips and spine stay in a more relaxed, natural alignment. And number 1, going to bed within 2 to 3 hours of a large meal or alcohol. Now, I know this one is part of life for a lot of us. Evening dinners, a social drink, these are enjoyable, and I'm not here to take that away from you. But from a cardiovascular standpoint, this combination is the most impactful habit on this entire list. And here's the why. When you eat a large meal, your body redirects blood flow toward your digestive system. That's a completely normal response. But in younger adults with flexible blood vessels, the body compensates easily. As we age, with arteries that are a little stiffer and circulation that's a little less adaptable, that redistribution can sometimes cause dizziness or lightheadedness during sleep. Now add alcohol to that picture. Alcohol causes your blood vessels to dilate, which drops blood pressure. For someone with healthy, flexible vessels, that feels relaxing. But for seniors managing plaque buildup or vascular stiffness, that sudden drop triggers a compensatory response. Blood pressure then rises to correct itself, then may drop again. These fluctuations stress the vascular walls, quietly, over and over, through the night, while you're not even aware of it. Here's a practical recommendation. Try to finish dinner at least 3 hours before bed. If you enjoy a glass of wine in the evening, give yourself 4 to 5 hours before sleep. And a 15-minute walk after dinner, just a gentle stroll, can help your body process that meal more smoothly and reduce the overnight strain considerably. That one habit change alone can do more for your nighttime cardiovascular health than most people realize. Now, here's the part I really want you to take with you, what you should do instead. The first recommended position is left side sleeping. And here's the why, because I think this one is genuinely fascinating. Your heart sits slightly left of center. When you sleep on your left side, gravity actually works with your heart instead of against it. Blood circulates more smoothly, your heart works a little less, your brain receives better oxygen flow through the night. But here's something even more interesting that researchers discovered about 10 years ago. Your brain has its own waste clearance system, sometimes called the glymphatic system. Think of it as your brain's overnight cleaning crew. While you sleep, this system flushes out certain proteins and metabolic waste. Research has shown this system works most efficiently when you sleep on your side, particularly your left side. This matters a great deal for long-term brain health. Over years and decades, better overnight clearance may play a role in protecting cognitive function. So left side sleeping isn't just about circulation tonight, it's an investment in your brain for the years ahead. If you've been a right side or back sleeper for decades, switching takes adjustment. A body pillow hugged in front of you is one of the most practical tools for this. It keeps you naturally positioned to the left, supports your spine, and if you have joint pain, a smaller pillow between your knees takes pressure off your hips. And if you roll over in the night, that's completely normal. The goal is simply to spend more time in a helpful position than a straining one. The second recommended position is back sleeping with gentle elevation. Not flat and not sitting upright. A gradual incline of about 15 to 30 degrees, raising your entire upper body, not just your head. A wedge pillow works beautifully for this, or an adjustable bed if you have one. 3 reasons this position works well. First, blood returns to your heart more easily from your lower body, which is especially helpful if you're managing circulation concerns, swollen ankles, or varicose veins. Second, it gently reduces pressure inside the skull, which can support seniors managing blood pressure or fragile blood vessels. Third, your airway stays more open, which improves oxygen delivery through the night and can reduce snoring. One small tip: if you elevate your upper body, place a small pillow under your knees as well. This keeps your spine in its natural, gentle curve and takes pressure off your lower back. It's a very comfortable setup once you adjust to it. Now, a word of honesty here. This position doesn't work the same for everyone. If you have severe sleep apnea, left side sleeping is usually the better choice. If you have shoulder arthritis, the elevated back position may offer more relief. The point is to understand why these positions work, and then apply that to your own situation. Your doctor can help you decide what's best for your specific health picture. Let me also share a few quick tips about your bedroom environment, because even a great sleep position won't do its full job if these basics are off. Keep your room cool. Somewhere between 64 and 68 degrees Fahrenheit is ideal. A cooler room helps your core body temperature drop naturally, which supports deeper, more restorative sleep, and can help lower nighttime blood pressure. Try to limit screens, phones, tablets, television, after 9 in the evening. The light from these devices delays the deep sleep stages, where your brain and cardiovascular system do their most important overnight repair work. Use one well-fitted, supportive pillow, rather than stacking several. And if noise is an issue, even sounds that don't fully wake you can disrupt your sleep cycles and cause subtle stress responses. A white noise machine or simple earplugs can make a real difference. These aren't complicated changes, but they work together to create the conditions your body needs to truly recover while you rest. Here's what I really want you to take away from today. You don't need a prescription for any of this. You don't need expensive equipment. You need awareness and 1 or 2 small, targeted adjustments. Pick one thing from today. Maybe it's shifting to left side sleeping. Maybe it's finishing dinner a little earlier. Maybe it's swapping out your pillow stack for a single supportive one. Start with just one change. Give it 7 days and pay attention to how you feel in the morning. Notice whether headaches ease up, whether that foggy feeling improves, whether you wake up a little more rested. Your body will tell you if it's working. If this video helped you understand your sleep a little better, please give it a like. It only takes 1 second, and it helps this information reach another senior who might need it just as much as you did. And if you are not subscribed yet, hit that subscribe button right now and turn on the bell icon so you never miss a video. Every week, I cover health topics that genuinely matter for people over 60, things your doctor may not always have time to explain. Take care of yourselves, and I will see you in the next one.